So this was trial E1308, and the way this trial was designed was that patients who had HPV-associated locally advanced oropharynx cancer were treated with induction chemotherapy. If they had a clinical complete response to the induction chemotherapy at the primary tumor site, we then treated them with a reduction in the dose of radiation for the definitive treatment. So rather than getting 70 gray of radiation, they got 54 gray, quite a substantial reduction actually. And instead of getting cisplatin as the radiosensitizer, they received cetuximab. So the most important probably symptom for these patients is difficulty swallowing solids. And we saw, using the Vanderbilt Head and Neck Symptom Survey, that there was a reduction in that problem from about 100% in the patients receiving full dose radiation to 37% in the patients who received the reduced dose radiation. They looked at a number of other side effects that patients have, some such as difficulty swallowing liquids, were not very different between the two groups. One that was quite striking was reduction in general pain, which was 50% in patients who received the full 69 gray of radiation and reduced to 27% in the patients who had received reduced dose radiation. Across the board, if you clustered all the different symptoms together, 100% of patients who had had full dose radiation had after effects that persisted at 12 to 24 months, whereas only 70% of the patients with the reduced radiation dose did. So overall, we think this gives a good underpinning to the further study of reduced dose radiation in these patients, and it gives us some targets for endpoints we can use in future trials.